Video is a pediatrics Osce video of group number 6, and our topic is a 2-week baby with poor suck. So as we all know that breast milk is very important source of nutrition for a baby in their initial days of birth. So if a baby is present with a very poor suck, it means the nutrition amount in the body of the baby would be decreases, and their growth and development, like physical development and the mental development, will be somehow retarded. So now the question is, when does the sucking reflex develop? So for that we have to know that the sucking reflex start developing from the 32 week of the pregnancy, and it would be completely and totally develop up to the 36 week of the pregnancy. And after birth, up to the 4 month, the sucking reflex is involuntary, but after 4 month that would be converted in the voluntary sucking reflex. Means the involuntary sucking reflex will be disappear after the 4 month of the birth of baby. The normal sucking reflex is developed in the 2 stages. When we place the nipple inside the mouth of the baby, then baby will automatically start the sucking of nipple. Then this nipple may be from the breast or from the bottle, it doesn't matter. The baby will show the same response to the both of the nipple. Now the second step is, how does baby suck the nipple? So for that, baby take the help of the tongue and the roof of the mouth and start sucking the nipple. Now how do we know that the baby is with poor suck? So for that we have to notice if the breast and the nipple is coming out of the mouth of baby again and again with a slight movement of mother's part, or the breast milk is leaking out of the mouth of the baby while breastfeeding. So these are some signs of a poor suck in the baby. There are some other factors that are also involved in the poor sucking of the baby, like the position of the baby and the attachment between the baby and the breast. So that all also matters in the poor sucking. As we know, there is a criteria for the breast and the baby good attachment, like when a baby is taking the breast milk. So for that, at that time, the position of the baby should be straight, the face of the baby should be facing the face of the mother or the body of the mother, and the lower lip should be widely open, mouth should be widely open, and the chin should attach the breast of the mother, and the upper part and the upper areola part of the breast should be visible. So these are some criteria for the good attachment between the breast and the baby. So that should also be check out at the time of seeing the poor sucking of the baby.
Hello everyone, this Kashyap Prakshi now let us know the difference between rooting and the sucking reflex. In rooting reflex, the baby basically searches for the breast and the nipple. In sucking reflex, the baby suckles the nipples of the breast for its nutrition. Rooting reflex, it is instinctual. Now let us proceed on to the test for these two reflexes. Starting with the sucking reflex. In sucking reflex, we'll put a finger, a pacifier or the nipple of the breast or a bottle inside the baby's mouth. On doing it, the baby would put its lip around the object and suckle it rhythmically between its tongue and palate. In rooting reflex, we will simply stroke the cheek or the mouth of the baby. On doing that, the baby would turn its head. And these are the two tests of the two reflexes. Thank you.
Plantar reflex. It is stimulated when the bottom of a baby's foot is touched. We will notice that their big foot extends upward and the rest of your toes flare out.
Neonatal reflex. Primitive reflexes are reflex actions originating in the CNS that are exhibited by normal infants, but not neurologically intact adults, in response to particular stimuli. Startle reflex. It may involve the infant suddenly splaying their arms and moving their legs before bringing their arm in front of their body. Rooting reflex. It starts when the corner of the baby's mouth is stroked or touched. The baby will turn his or her head and open his or her mouth to follow and root in the direction of the stroke.
Palmar grasp reflex. When any object is placed in an infant's palm, the finger flex reflexively around the object.
Why sucking problem happen? The baby must be able to remove enough milk from the breast through correct latch and sucking to gain weight. This milk removal then tells the breast to increase or maintain milk production. If the baby does not get enough milk, he or she will have poor weight gain. Poor milk removal from the breast can also affect the milk supply. Then many things can affect baby ability to suck or remove milk. Factors such as prematurity, jaundice, infection, heart disease, mother's medicine, tongue tie, cleft palate, and many other affects the baby ability to affect the coordination of the milk production. This might directly interfere with the baby ability to use the structure of the mouth for effective sucking.
Today I am going to say signs of ineffective sucking. Doesn't make his or her own cues after feeding. Cues fewer than 8 times in 24 hours period. Seems gassy or produce green frothy stools after the first week. Latches on and then lets go of the breast repeatedly. Pushes away or resists latch on. It produces fewer than 6 wet diapers per day. The mother who has sore or bruised nipples or areola. It gets red, scrapped or cracked nipples. It often mishaps nipples after feeding. It rarely or never notices breast fullness before nursing or after nursing. It has more than one episode of plugged milk ducts or mastitis. Thank you.